today's presentation, I would like to thank the co-chairs of our caucus, Representative Steve Stivers from Ohio, Representative Joe Barton from Texas, Representative Jacques Disease from California, and Representative Steve Cohen from Tennessee. It's their commitment and dedication that makes our caucuses a success. The Coalition for Life Sciences, of which I am the Executive Director, has been hosting these monthly caucuses for 26 years. And today it is my distinct pleasure to introduce Dr. Peter Hotez. Dr. Hotez is Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine, where he's also chief of a new section called the Pediatric Tropical Medicine and the Texas Children's Hospital Endowed Chair of Tropical Pediatrics. He is also the president of the Sabin Vaccine Institute. That must be one heck of a business card. Dr. Hotez is an internationally recognized physician scientist in neglected tropical diseases and vaccine development.
It's actually double-sided.
Oh, see? He leads the only product development partnership for developing new vaccines for hookworm infection, snail fever, and Chagas disease. And these are diseases that affect hundreds of millions of children and adults worldwide. He has obtained his undergrad degree in molecular biophysics from Yale University in 1980, followed by a PhD from Rockefeller University in 1986, and an MD from Weill Cornell Medical College in 1987. Dr. Hotez has authored more than 300 original papers and is the author of the acclaimed book, Forgotten People, Forgotten Diseases. Dr. Hotez served previously as president of the American Society of Tropical Medicine and Hygiene and founding editor-in-chief of the PLOS Neglected Tropical Diseases. He is an elected member of the Institute of Medicine of the National Academies of Science, and in 2011 he was awarded the Abraham Horvitz Award for Excellence in Leadership in Inter-American Health by the Pan-American Health Organization of the World Health Organization. In 2015, the White House and the U.S. State Department selected Dr. Hotez as a United States Science Envoy. With all that, please join me in welcoming Dr. Hotez.
So, what I'm going to do today, I'm going to talk a little bit about what I'm doing as United States Science Envoy, and I'm actually testifying to the House Foreign Affairs Committee this afternoon at 2:30 about that. But also to tell you about what I think are some of the really important trends that you need to know about emerging neglected diseases. And during the fall last year, I was on either MSNBC or Fox News every day talking about Ebola virus infection. And you can imagine the challenge of going from MSNBC to Fox News and back again. So that was a lot of fun, given how ideologically different they both are. But so really the substance of this talk is I'm going to tell you all the things I wanted to say on television, but where I couldn't get the time because they were so focused just about Ebola virus infection. To tell you about what I think are some of the big trends in infectious diseases that not many people know about and not many people have heard about. So I'm going to start out talking about this interesting group of diseases called the other diseases. So if you know about the Millennium Development Goals that were launched in the year 2010, there was a Millennium Development Goal specific for infectious diseases. This was launched by Kofi Annan, who was Secretary General of the United Nations, and they launched these 8 to 10 Millennium Development Goals for poverty reduction throughout the developing world. And there was one that was called to combat AIDS, malaria, and other diseases. And the AIDS and malaria part are the parts that provided the framework for launching PEPFAR, the President's Emergency Plan for AIDS Relief. Anybody know what PEPFAR is funded to now? Since you're paying for it now. It's $8 billion a year, so it's about a fourth of the NIH budget. It launched the President's Malaria Initiative. It launched the Global Fund to fight AIDS, TB, and malaria. So these were big public health initiatives to get people on essential medicines and treatment. The problem was the third part of that statement, to combat AIDS, malaria, and other diseases, they actually called them other diseases, which from an advocacy perspective was a total disaster. You can imagine you're not going to get Bono and Angelina Jolie standing up there saying, now other diseases, right? It didn't happen. So we actually made up a term in 2004, 2005, after the MDGs called the neglected tropical diseases, which is for the other diseases component. And that's where Ebola falls under and a lot of other tropical diseases. And we've just now done an assessment of these. And I even wrote a book about these other diseases, which my kids called Dad's Forgotten Book on forgotten people with forgotten diseases. But now it's in its second edition. And I'm going to rank for you now the most common afflictions of people living in poverty. So, other than AIDS, TB, and malaria. So let's see if you get any of them. What's the most common affliction of people living in poverty other than AIDS, TB, and malaria? Anybody want to guess? Stomach thing, that's good. Close, ascariasis. So ascariasis isn't, anybody know what it is? It's intestinal roundworm infection. So it's the most common affliction of people living in poverty. Ascariasis is the most common disease, and it causes intestinal obstruction, but it also causes growth failure, and it shaves IQ points off of kids. And that's why a lot of these diseases are important. It's not because they're killer diseases, but they're debilitating diseases. And that's a tough message to get across to policymakers, because if you only have a soundbite, right, you know, the malaria and AIDS people, I'll talk about the number of people dying, we don't have that language for a lot of these diseases because they take more than a soundbite. So I'll explain that in a minute. So ascariasis is the most common affliction of people living in poverty. Next one is trichuriasis. What's that one? Isn't that amazing? The most common afflictions of people living in poverty, no one has ever heard of them. That's what I call these diseases, the most important diseases you've never heard of. That's whipworm infections, the leading cause of inflammatory bowel disease in the world. This is hookworm disease, dengue fever, schistosomiasis, lymphatic filariasis, onchocerciasis, I can say them faster than everyone, foodborne trombococcitis, cutaneous leishmaniasis, Chagas disease, trachoma, cysticercosis, echinococosis, visceral leishmaniasis, African trypanosomiasis, rabies, yellow fever, yaws, Bruley ulcer. And there's Ebola down there. So Ebola doesn't even register as, you know, one of the top 15 common neglected tropical diseases in the world. And as I said, many of them some of them are killer diseases, but many of them are not. They tend to be debilitating. So let me give you an example of this. So let's talk about that top one there, hookworm and ascariasis. How many people with ascariasis? Anybody remember? You're good, 819 million people. And hookworm, anybody remember hookworm? Good. So let's do a deeper dive here. So what I'm showing you in the right is a wormy curve. A lot of these are worm infections. And it's showing age on the x-axis, number of worms on the y-axis. And you can see that as you live in these poor countries, you have more worms as a kid than you do as an adult. So it peaks between the ages of 4 and 15. So you get that little girl on the left from Paraguay with her big distended belly. And on the bottom here, it's my master's student holding the worms from that one kid. Why is that? Why do kids have more worms than adults? Kids eat more things from the floor. It's a great hypothesis. Give me another one. Yeah, someone's going like this, putting things in their mouth, right? Some people say immunity. It's actually a trick question. We have no idea. These are neglected tropical diseases. So the most common afflictions of kids, we don't even know why kids have more worms than adults. And the consequences of that are on the bar graph in the middle there, where they're not dying, but the more worms you have, the greater your loss in intelligence. Worms shave IQ points off. And why is that? The worms are in the gut. Why are they affecting the brain? We don't know. And they're also affecting physical growth. This is a growth curve, growth chart you might recognize from your pediatrician's visits way back when. And you follow yourself along the 3rd, 10th, or 20th percentile. Here's a kid with flatline growth till we get rid of the worms. So the point is, not only are these big health problems, they're economic problems. So chronic hookworm infection in childhood reduces future wage earning by 40%. So these are the diseases that trap the bottom billion, the 1.3 billion people in the world live below the World Bank poverty figure in poverty. And we've now created this new measurement to go along with Human Development Index. How many people have heard of HDI, Human Development Index? It's a complex measurement that includes years of education in your country, how you treat girls and women, the quality of life measurements. And what I've done is rank the top 25 countries by population according to their Human Development Index. So you get the USA over on one side and Democratic Republic of Congo on the right. And what we've done now is actually count the number of people infected with these neglected tropical diseases in those countries. And what you can see is that there's an inverse correlation between Human Development Index and worm index. So it's actually a marker, a biomarker for poverty and for lack of human development. I presented this information to the President's Commission on Bioethics. They were doing a deep dive into the Ebola outbreak in West Africa. And if you look at Guinea, Sierra Leone, and Liberia, now we're up to about 20,000 people with Ebola virus infection, which is about 0.1% of the population. And all of the focus, of course, has gone on Ebola, not recognizing that, that it's not nearly the top global health problem affecting Liberia, Guinea, and Sierra Leone, when you've got a third of the population infected with schistosomiasis, malaria, and hookworm infection. And those three diseases combine to produce profound anemia and loss of IQ, as well as inability to go to work. And so the point is these neglected tropical diseases are the real reason why these countries can't escape poverty. And so while obviously it's clear that we need an attention to diseases like Ebola, there are a number of other important things out there we need to consider. The other interesting link we've noticed is this link with conflict. So we call them, these neglected tropical diseases are diseases of poverty, but they're also diseases of conflict. And the reason why Ebola emerged out of West Africa was not because it was tropical, although that was a component of it. It was because Liberia, Guinea, Sierra Leone have only recently emerged out of terrible conflict and post-conflict, and with that breakdown in public health infrastructure, with that deforestation, human migrations, and that's why it arose there. And I'd like to make the point that we've seen this dance before. The link between the emergence of a deadly neglected tropical disease and conflict is not new. It's a pattern that we've been seeing since the 1970s, but it's just that no one had really been paying attention to. So an example of this in the 1970s, in Angola and the Democratic Republic of Congo, more than 500,000 people died as a result of the conflict there, not from bullets, but from African sleeping sickness. It happened because the conflict eroded public health infrastructure in those countries. And we went back up to 1920s levels. And we saw it again in the 1980s in South Sudan, where more than 100,000 people, 10 times more than those who died in the Ebola outbreak in West Africa, died from Kala-Azar, visceral leishmaniasis, from the same kind of thing. So this has been a recurring theme now we've seen for the last 30, 40 years. Horrific conflict, breakdown in public health infrastructure, and the emergence of a catastrophic neglected tropical disease. Sleeping sickness in Congo and Angola in the 70s, Kala-Azar in South Sudan in the 80s and 90s, Ebola's version 3.0. What's their version 4.0 going to look like? Where are we going to, knowing that there's this intimate link between conflict and contagion, where's the next shoe that's going to fall in the world? You don't have to name the disease, but where's it going to happen? Yeah, I think it's going to be ISIS-occupied Syria and Iraq. Right now, there's complete collapse of public health infrastructure there. World Health Organization, other international agencies can't get in there. We're only getting glimpses of what's going on from the refugees spilling across the border into Lebanon, into Jordan, into Egypt, into Turkey, where we're seeing the reemergence of polio, reemergence of measles. We're seeing widespread diseases such as cutaneous leishmaniasis, which the locals call Aleppo evil. And now I'm worried about the MERS coronavirus infection. And so we've done a deep dive on where those neglected tropical diseases are of the Middle East and North African region. And this is we publish this in the Public Library of Science. And here's an accounting as best we can of the Middle East and North Africa region. They're basically every single person in poverty in the Middle East and North Africa is affected by one or more of these diseases. So here's an example of one. It's called cutaneous leishmaniasis, which the locals call Aleppo evil. There's been more than 100,000 new cases of it over the last year. How many people have heard of it? So it's a disease that's transmitted by sandflies. It's a parasitic infection. And as the cities have fallen apart, there's been no garbage collection, the sandflies have proliferated, and they're transmitting this parasitic infection. It's not a killer disease, but it disfigures people, especially little kids. And so it causes a horrific ulcer that when it heals, it causes a permanent scar. And if it happens to little girls in the area, then they're rendered unmarriageable. It's grounds for spousal abandonment. So it's a huge social problem as well. And the treatment is to inject the lesion with a very toxic antimony compound, which is not available now because of the hostilities. And so the sandflies are following the refugees pouring across the border. And the same with, we're concerned about the MERS coronavirus infection, which is a highly lethal disease that arose out of the Arabian Peninsula, and now I'm quite worried that it's going to devastate areas of Yemen. So I think these are the new areas that we really have to be concerned about. And my role as U.S. Science Envoy, I'm also head of this organization called the Sabin Vaccine Institute, which is a nonprofit organization. The labs are based in Houston, Texas, at the Texas Medical Center, that makes the vaccines that the drug companies can't make or won't make because they affect only people living in extreme poverty. So we have to make them in the nonprofit sector. And here's our portfolio of products that we're making, which includes a leishmaniasis vaccine and now a MERS vaccine. And my role as science envoy is to say, well, could we build a parallel infrastructure for that in the Middle East and North Africa? Because right now, those regions have almost zero capacity to make their own vaccines. So Iran has a little bit, the Israeli Defense Force a little bit, but that's about it. There's almost no capacity for making vaccines. We've always had to rely on Big Pharma. But the problem is Big Pharma, the GSKs, the Mercks of the world, are not going to touch diseases of extreme poverty unless there's a guaranteed money source for that, nor are they going to touch problems of regional importance, not global importance. So the only reason GlaxoSmithKline and Crucell got into the Ebola virus vaccine game is because they realized at the 11th hour, even though the technology had been there for 10 years, nobody had bothered to put it into a vaccine. It's because there was no market incentive. Only when the US government came around and guaranteed a market that they came around at the 11th hour. And now we got this disastrous situation where they're just doing phase 1 clinical trials now when the Ebola outbreak is over, and they can't even assess whether the vaccine works. So Ebola was an example of how everything went wrong, and what we should be doing now is seeing how we can build capacity. So the President and the White House and State Department is sending me to some stable countries in the Middle East that has some semblance of scientific infrastructure to see if we can build that capacity. And we're looking at Morocco, and I just came back from Morocco, and I'll be going to Saudi Arabia in a few weeks. The other thing I want to tell you about before we finish up is when we did this deep dive on enumerating the number of neglected tropical diseases, we found something very interesting. We assumed the Middle East was a surprise, but the other big surprise was, while there's a lot of disease coming out of Africa, there's just as many coming outside of Africa. And one of the interesting features is the very high prevalence of neglected tropical diseases in G20 countries. So what are the G20 countries? 20 largest economies. So what I'm showing you here are areas of intense concentration of neglected tropical diseases in regions of poverty in the top 20 countries. Because what happens is countries like Brazil, although they're a G20 economy, if you go to the northeastern part of Brazil, there's intense poverty, like in Pernambuco state, or if you go into China, it's not so much in Shanghai or Beijing, but you go into Sichuan province, Yunnan province, Guizhou province in the southwest, you go back in time 50 years and you find that intense poverty. And so what we noticed in southern Mexico is that actually the G20 countries, the 20 wealthiest economies, account for an incredible amount of neglected diseases, as well as malaria and TB and HIV/AIDS. And so there needs to be greater public pressure on some of these G20 countries to have greater accountability. Now, and it's a concept that I call blue marble health. So this old idea of global health, of developing versus developed countries, what we're seeing is a morphing. It's becoming, all economies are rising, but it's leaving behind a bottom segment of society. So what's going on with that little bit of blue in the southern part of the United States? Do we have poverty in the US? How much poverty? So there's 46 million Americans that live below the poverty line, and I wouldn't say for a minute that's the same level of poverty as Indonesia or China, but we do have 20 million Americans that live at 1/2 the US poverty level, what we call living in extreme poverty. And now we have 1.65 million families that live on less than $2 a day, around 5 million people. So we could take that same benchmark for global poverty and apply it to the United States. And it's primarily concentrated in the southern part of the US. And guess which state has the largest number of people living in poverty? Someone say it louder. Texas, actually. Mississippi is the highest percentage of people living in poverty, but overall largest number of people living in extreme poverty live in Texas. So what we did was to kind of take that global health lens that we've been working all over the world, taking on neglected tropical diseases in places like Africa and India, and turn it inward on the United States. And I remembered this book that I was forced to read in high school, and I had forgotten about it for like 30 years or 40 years. And it's by this book by Michael Harrington called The Other America. Anybody ever read it or know about it? So this was required reading in high school, and I resented it at the time, but I took it off the shelf, and there it was, and there was this beautiful statement that he says, to be sure, the other America is not impoverished in the same sense as those poor nations where millions cling to hunger as a defense against starvation. This country has escaped such extremes. This does not change the fact that tens of millions of Americans are at this very moment maimed in body and spirit, existing at levels beneath those necessary for human decency. They are without adequate housing, education, and medical care. So we did a thorough analysis published in the Public Library of Science on the neglected tropical diseases in the poorest parts of the United States. And what we identified is that 12 million Americans live with a neglected tropical disease in the United States, mostly in the South, mostly people living in extreme poverty, mostly people of color. And so the question would always come on MSNBC or Fox News when I was on every day for the fall, doctor, aren't you worried about Ebola virus coming to the United States? And the answer was no, I'm not worried at all. And here's why, because it's a very difficult disease to transmit, and here's why there will never be an Ebola outbreak in the United States. And then I said, but I am concerned about 12 million Americans who live in poverty and live with a neglected tropical disease. And the answer was always the same, whether it was MSNBC or Fox News, which was, thank you, doctor, we're out of time. So it was an inconvenient truth that we don't want to admit that we've got this hidden burden of disease and poverty. So I wrote about this in the New York Times. And it was quite interesting, the response, both from the political right and the political left. So what did people on the political right say? What was their immediate response? I mean, you know, when you read the snarky comments that are on the internet by all the trolls, so what was the first thing that came up from the political right?
Impeach Obama.
What? Well, of course, impeach Obama, but after impeach Obama, that actually came from some of the mean girls from Fox News too. But no, it came. The criticism was it was immigration. Right? We got to build the wall higher because all these people are bringing diseases up from the South. But the point is, we find transmission of these diseases in the U.S. And I'll go through that in a minute. And I also got a lot of unfair criticism from the left. What did the people from the left say? You would never guess this, but it was interesting getting this op-ed piece to the New York Times. It's an iterative process. They really wanted me to stick it to Governor Perry. They said it must be the policies of Governor Perry that were responsible. But I said, look, these diseases, there's evidence these diseases have been around 1,000 years in Texas. And I know he's been governor a long time, but he hasn't been governor that long. So people are very quick to politicize disease. So that was the point going on, trying to get word out on MSNBC and Fox News that don't worry about Ebola, worry about the 12 million Americans living with neglected tropical diseases. How much time do I have? Oh, that won't take that long. Let me just tell you about, you want to hear just about a few of the diseases that are here? So one of them is called Chagas disease. It's a disease that's transmitted by kissing bugs, and the parasite goes into the heart and causes a debilitating heart disease known as Chagas cardiomyopathy. The highest percentage of people live in Bolivia. Brazil has over 1 million people living with Chagas disease. These are the most recent numbers from the World Health Organization, so Argentina, Brazil leads. But the United States has an estimated 300,000 people with Chagas disease. My estimates suggest it could be as high as 1 million. We just don't have enough baseline data, with about half of those diseases in Texas. So this is what the parasite does. It enters the heart and destroys the heart tissue and switches the normal heart tissue over to fibrosis, so people present with debilitating heart disease. The problem is doctors and nurses are not trained into thinking about tropical diseases. So somebody like this might get diagnosed as having coronary artery disease. So they could be debilitated or even die, never getting diagnosed with Chagas disease. And now there's been another route of transmission identified from mother to baby. So there's we estimate around 40,000 pregnant women in North America, including Mexico, and we're getting vertical transmission to mother to baby 5% of the time. And in terms of economic costs, we estimate about $7.2 billion globally, $864 million to the economy because of lost productivity and healthcare costs, and about half of that in Texas. So this is a disease that's costing people of Texas around $400 million a year, and nobody knows about it. And this is the range of where the disease is. This is these are places where we're finding dogs infected. So again, the dogs are not slipping in across the border from El Salvador and Mexico. We've had transmission here for a long time. We're finding it among hunters and campers in Texas, which is interesting. We're finding among the homeless. So we're really trying to understand how exactly they're getting infected. These are some recent papers of ours where we've been able to look at the transmission patterns in the state of Texas, including in Houston. So we actually have a therapeutic vaccine under development that we're doing with some private support. We've not gotten any federal support to make the Chagas vaccine. It's actually being made as an immunotherapy for the treatment of Chagas disease because the drugs currently are highly toxic. And we've actually had to develop laboratory animal models. I know you're not used to looking at EKGs of mice, but we've been able to now reproduce the heart effects in mice. And now I'm going to show you a normal, I don't know if I can do this. Can I do this? Will that? Oh, I don't know if I can. I guess I can't click on it. Can you click on the little arrow there? This is kind of fun. We've just done this. So you can click on the echo there. Click on the arrow, go down. Right here? Yeah, see if there's an arrow there. No, it doesn't let you do it. But in any case, we've done this. So that vaccine is advancing. The other big one that's affecting people in poverty in the United States is called Toxicarias. And it's a parasitic worm infection that are transmitted from dogs. So when you go into poor areas, like you go into the 5th Ward of Houston, you see a lot of dilapidated housing, but also stray dogs. And those stray dogs, 100% of them are infected with these worms. They're dropping eggs in their feces, and kids are coming into contact with them. And these worms migrate through the brain and the lungs, and we estimate 2.8 million African Americans in poverty with toxicariasis. And it's been linked to developmental delays as well as asthma. The question is, if there's 2.8 million African Americans with this disease, what's the link then with asthma and developmental delays among the African American community? So we published this in JAMA Psychiatry and recently to pose this question, but it's totally uninvestigated, totally unknown. Guess how many NIH grants have been given out for Ebola virus infection? I don't know either, lots. How many for toxicariasis? Zero. So unless you know of one that just happened, no.
Just one.
Well, we tried. We got turned down for funding, but we will get it back. So you know, there needs to be better balance in terms of how we appropriate money for diseases. Cysticercosis, around 40,000 to 169,000 cases of epilepsy linked to cysticercosis. A word about the global dengue pandemic. We're in the middle of a dengue pandemic right now with 390 million cases. India is getting hit particularly hard, but with the mosquitoes that transmit dengue fever are in the United States. This is the major vector. It's called Aedes aegypti. And you notice South Texas, Florida, and Arizona are, these vectors are widespread. This is a different one. It's less efficient at transmitting dengue, but it still can do it. So we've actually did an analysis, and we found that Houston actually emerged as the first major city in the United States with the dengue epidemic in 2003. It happened again 2004, 2005. And it was mostly located on the 5th Ward of Houston, which is a very poor, predominantly African-American neighborhood of Houston. What is it about poverty that's making people susceptible to dengue fever? So we don't know either. But if you look at a picture of the 5th Ward, you can start piecing you can make some guesses. You're seeing dilapidated housing, you're seeing lack of window screens, standing bodies of water, lack of drainage. We think all of these are appropriate factors. But we need to better understand this link between poverty and neglected tropical diseases. And lastly, I'll end, we're getting pretty concerned now about chikungunya, which is another arbovirus infection transmitted by the same mosquitoes that transmit dengue. It's taken hold in the Caribbean. I predicted it would hit Houston last summer. It didn't, but I would think it probably will this summer. And this is going to be, but again, the word that doesn't get out is going to disproportionately affect the poor. So we're now working with several congressmen now to introduce this piece of legislation called the End Neglected Tropical Disease Act, which talks about diseases globally, but also talks about them here in the United States. Michelle, who are the Congressman Smith is introducing it from New Jersey?
This was from last year.
Yeah.
And Congressman Smith, as well as co-sponsors were Matt Salmon, Hank Johnson, and also Ray Weeks.
Right. So I'll be talking about this today also with the Foreign Affairs Committee. So that's it. So just to give you an overview of some non-intuitive things that you don't hear about tropical diseases yet, which are of enormous importance, both in areas of conflict zones in the Middle East and also to right here in the United States. So thank you. Questions?
Yes. Can you say something about so it seems to me from looking at CDC data that there's been a steady, not a minor, but a rather significant increase in asthma cases in the last 10, 15 years. But at the same time, the levels of ozone and smog have gone down. So now I'm wondering if there's any connection, because you were talking about the
Could this
Toxicarias
be an important environmental cause of asthma?
and not only that, are there contagious diseases that are also exacerbating asthma? Because am I correct or incorrect in saying that asthma has pretty complex etiology, right?
Yeah, and if you look at the populations that are at greatest risk for asthma, it's often inner city kids or kids living in with low socioeconomic backgrounds, and those are the same populations that are also at risk for Toxicarias. So is Toxicarias a major environmental cause of asthma that nobody's investigating? I think it is, but I can't prove it yet. So
are there others? I mean, there's this Toxicarias. Are there other, infectious or contagious diseases that could that may even have a remote impact?
Certainly, another one are certain viruses will elicit allergic-like symptoms. For instance, RSV, respiratory syncytial virus, which is very common among young children, seems to be an important cofactor in asthma. We know that as well. And thanks for the question.
It sounds like both public health efforts and research efforts to address these diseases, both in the U.S. and globally, are woefully underfunded. So I'm wondering, in the U.S., what are the mechanisms for funding efforts? And understanding they're probably underutilized, where would you think that the greatest could be?
So the funding tends to, the metaphor I use is a little kid's soccer game. You know, the ball goes over there and all the little kids, if you ever watched little kids playing soccer, all the little kids ran after the ball, then the ball moves over here and all the little kids ran after the ball again. And so there's not enough balance to really take a step back and say, there's this massive response to Ebola virus infection, and I understand the worry and everything else, but to not do anything for 12 million Americans living with neglected tropical diseases, we need to fix that. So, as well as the risk of neglected tropical diseases emerging abroad as well. So I think part of this piece of legislation may be a beginning for it. One of the problem with the mechanism is, in trying to work on this piece of legislation, is it requires two groups that don't talk to each other a lot, which is both foreign ops as well as health and labor. And so bringing them together has been a challenge. Michelle, any thought? Michelle heads government affairs at Sabin Vaccine Institute.
Yeah, I think the biggest challenge is that we've seen that global health funding has stayed pretty consistent because of the success of the programs. But then we've always got to have the challenge of working against malaria, HIV, TB. So we're always kind of a small guy trying to make sure that we're getting the full funding. I think it's just broadening the awareness among members of Congress so that they are also chiming in and voicing concerns that, these are doable and we can actually see some markers moving forward and see elimination in some cases. And so just building that consensus and getting more people aware is probably the best thing.
There may not be a lot of money going towards some of these diseases, but a lot of money is going towards halting the spread of the mosquitoes with these diseases. Can you talk at all about that kind of research? Is that helping? Is there any impact on that? Or?
Well, I'm not sure what you mean. I mean, globally, there's a lot of money right now being put into malaria control through the use of insecticide-treated bed nets. And that's having an impact. We just did an analysis of that. We're looking at, over the last, between 2004 and 2013, there was a 30% drop in the number of malaria cases and the number of malaria deaths. So that is having an impact. But it's a matter of now trying to figure out how to do that in the United States as well. Yes?
How worried are you about, so I know you're focusing more on contagious diseases, infectious diseases in general, it seems like certain diseases like AIDS or some other TB, for example, get a substantial amount of funding. Maybe I'm wrong, but I just know in the NIH there's a whole institute for cancer, there's a whole institute for heart. It's not a bad thing, but I guess point being that
so what we're proposing is for neglected diseases, especially both affect the U.S. and globally, is try to create a center of excellence here in the United States. That would be a help. One or more centers of excellence for the study of these diseases, especially in a disease endemic area like the Gulf Coast or Texas, would be very welcome. That would be one way to go.
But I mean, and you probably would agree that sometimes it's these rare diseases that give insights to a whole host of other biological processes that have nothing to do with.
Sure. Well, there's always need for basic research. One of the things I like to say is, because people ask me about, are we handling a lot of these diseases under the Orphan Drug Act, the Orphan Disease Act, and these don't even qualify as being rare diseases. They're actually quite common. It's just that they're occurring among people who have no voice, so people don't know exactly the real number. So it really falls through the cracks. And then, of course, the Gates Foundation doesn't touch neglected diseases in the U.S. because their focus is exclusively globally. And so, well, no, they're doing a lot. They're doing polio. They're doing a number of things. Yeah. Good. Well, thank you very much. Okay.